I promise I will work hard to make my show informative, interesting, and entertaining. Be sure to listen to Seattle Here and Now on Rainier Avenue Radio.world.
Women are not an homogenous group.
We face discrimination differently depending on factors such as ethnicity, age, socioeconomic status, and more.
Rainier Avenue Radio is proud to amplify women's voices.
They are the experts of their own lives, initiating conversations within their community about challenges they face, the solutions they're working on, and the opportunities they see.
Please join us this Sunday from 2 to 5 for Women's Voices on Air. We know our challenges. We are the experts of our lives.
We are master multitaskers, prioritizing our family, friends, and our faith above our own needs.
Our needs and voices are too often overlooked.
Please join us this Sunday from 2 to 5 p.m. for Women's Voices on Air.
We tell our stories in our own way.
Love food? Here's some storage tips to keep it fresh longer. Store cut fruits and vegetables in the fridge. Place in reusable containers. Keep bread in the freezer for longer storage. 40% of food in the U.S. goes uneaten. Save money, save food, save the planet. Visit Seattle Public Utilities for tips.
I'm Paul Pearson, host of Star Time. And when I'm not cooking up a batch of my famous wood-flavored chicken, I'm listening to Rainier Avenue Radio.world.
Ever went over a friend's house to eat and the food just ain't no good?
Good afternoon. Welcome to Seniors Matter. I'm Brenda Charles Edwards, the host of Seniors Matter. We're live every Friday at 12:30 p.m. Pacific Standard Time on www.Rainier Avenue Radio, your South Seattle community radio station. You can also listen to us on YouTube, Facebook.com, and of course, the Rainier Avenue Radio app. We feature interviews with people that provide services or have valuable information for seniors, caregivers, and the community. Do you need financial documents notarized? Do you need documents read to you for clarity or completion? Just give me a call at Black Orchid Notary, 206-683-2636. Tell me where, I'll meet you there. Well, my guest today is Nathan Yemane, licensed clinical social worker and the managing director of Heart'N Soul. And it's the first African-American hospice in Washington State. Welcome to the show, Nathan. How the heck are you?
Hi, Brenda. I'm doing well. How about you?
Oh, I'm doing well. It's been really busy, but it's a good busy.
Okay. That's always good.
Yes, and I'm also in a caregiver mode. So I appreciate what you're doing. And I had you on a couple years ago when you were just starting out. So I'm really excited to know what's happening now with you now that you've been established and you've opened up your clinic. Or I guess I shouldn't call what do I know it's Heart'N Soul.
It's outpatient. It's an outpatient clinic. And so and I just wanted to say too, I have with me our volunteer coordinator, Janice Jackson Haley. And I just wanted to make sure she did a little plug about the volunteer program that she's running for our hospice that she's doing, a tremendous job in, and is been able to really help us get that going. And so, glad to be able to see and visit with you. It's been like you said, a couple of years. Mm-hmm. At that point, I think we had not, we hadn't even obtained Medicare certification yet, and so
you were going before the Department of Health.
That's right.
You were competing with two other companies.
That's right. Yes.
And my listeners wrote in and to the Department of Health or called in and, because it was a big deal. So I'm so glad that you got your certification.
Thank you so much. Thank you so much for the support, and thank you for, just being able to get the story out for your listeners to hear about why the work that we do in terms of providing end-of-life care in King County is such a important and a significant thing. And so just really appreciate that. Yes.
Well, it was our pleasure because, I'm involved with end of life too. I am a certified end of life planning facilitator. So
I was just telling Janice that, yeah.
Yes. So I believe in what you're doing, and because all aspects of it, and people don't understand about hospice. In fact, do you want to talk a little bit about hospice, or is Janice going to do that?
So no, I don't mind doing that. And then, we'll be able to kind of talk about, also what Janice is doing. But hospice is basically end of life care for anyone who has a terminal illness and has been determined by 2 doctors to have a life expectancy of 6 months or less. That doesn't necessarily mean that they do, and not in the sense that it's time stamped, but the estimate is that. Mm-hmm. So, and what we do is we provide, as a hospice, we provide nursing care, a medical director, nurse assistant, a social worker, and a spiritual care coordinator, and also volunteers to be able to support a patient who's been determined to have an illness with a life expectancy of 6 months or less, as determined by 2 physicians.
So what, and I should know this, but right now I can't remember the name, but what is it that the state of Washington lets you do if, you have this diagnosis and you decide that you don't want to go through a lot of suffering, and you can get the medication that would allow you to end your life, and it's legal.
Yeah, it's medical aid in dying. I could say a little bit about it, but I know Janice also is very versed in it. But it's called the Death with Dignity Act, yes. And it was put into law, and it is basically set up for individuals who have a terminal illness. They have to be seen by 2 doctors. 2 doctors have to approve, their wishes to, go with, death with dignity. And so, and they have to be able to self-administer the medication.
That's the key piece.
They have to have the ability to be able to self-administer. And also, like, I said earlier too, they have to be, mentally competent to do it. It's not just the physical aspect, psychologically speaking too.
Right.
And so, it all starts with a verbal request to a doctor. Mm-hmm. And that then is followed up with a written, and also there's, and Janice, I don't know what.
No, you said it. It's the medical support that you get, the medical diagnosis and support. But I think the other aspect of it is the physical, the spiritual support, the family support that you also get. And I think our hospice is unique in that we support patients that choose death with dignity. So I'm glad you brought that up because it is something that is available to our patients in hospice.
Well, that's good to know. I just had, my mentor who trained me to do what I do recently used that method because she was terminally ill. Yeah. And we had a luncheon with her about 3 weeks before it happened. And I had asked her, how will you know when it's time to do that?
Right.
And she was also a chaplain, and she was on the front line when AIDS was going on in the South. So she's had a lot of experience. But what she said to me was, I've always been blessed to know when it's time to do something. And when the time is right, I know he'll let me know.
Right.
What can you say to that?
You can't say anything. Right.
I told her I loved her, right. And so, yeah.
Brenda, thanks for sharing that. That touches us. In hospice, we hear and we are a part of the journey of folks that that experience that day in and day out, right?
Absolutely,
Nathan?
absolutely, absolutely. And you know, one of the things that I'll say too, and you know, just to brag on Janice. I know that you worked with a family, and there was a lot of dynamics there, you know, with the patient and the patient's child. And so, you know, you have to navigate kind of those dynamics and just, you know, figure out if and how that is factoring into the decision for the Death with Dignity Act that the patient is requesting, you know, the medical aid in dying. And so Janice has been able to help, you know, families navigate through that. But also in just being able to, like Janice said, just support and respect people's self-determination, you know, and that's at the end of the day, that's what people want, especially at end of life, you know.
Yes, absolutely. You have to be there to support them, whether you agree with it or not.
Right.
You have to support them and you have to love them.
Right.
So
one disclaimer or one point I do want to make is that, you know, we support our patients, you know, if they choose medical aid and dying. But one of the things I do want to say is that we don't force any of our staff members to either participate or take part or play any kind of role if they have whether it's a philosophical or a religious reason for why they don't want to in any way engage in that specific area, then they don't have to.
Well, and Nathan, I think too, education is so crucial with this, not only with your staff, but with people that are embarking upon it or the family that's, you know, trying to hear it and digest it, because it is new. I mean, it's been around for a few years, but it's new. And the key thing, like you said, is the person has to administer it themselves.
Right.
No one else is supposed to do it for them. And they have to be in their right mind and knowing and what they want and what they're doing.
Right, right. And there's just for clarification, when I say there's two physicians involved, there's going to be an attending and a consulting physician. And the attending physician is going to do most of the legwork and also some of the paperwork that has to be done after the patient has passed away. And the consulting is more there for support of the attending and also, but is not as involved. The consulting is not as involved as the attending physician is.
Okay, thank you for that clarification. So where are you located?
So we're in Renton, Washington, and so we're right off of Rainier and Grady, so 15 South Grady Way. We're in the Evergreen Building, and so we've been doing a lot of work. We've been doing a lot of work in the South King County area for the most part. The majority of our patients have been in the South King County, but we're for the entire county, you know, and we're available for the entire county. And so we've made ourselves available and accessible, and we, you know, still do a lot of education, still do a lot of community outreach. I was just at the Mayor's Council on African American Elders.
I used to be president of that.
I'm sorry?
I used to be president of that.
Oh, is that right?
Oh, great.
Yeah. Dr. Abe. And I know that Miss Karen Winston is not as involved. She retired, as you know.
Yes, I was MC at her going away party.
Oh, wow. Yeah. I have a lot of respect for Miss Karen. So
she's great.
And she's been a part of that group since like the mid 90s, you know. So if not, you know, I think they started out in the 90s, didn't they?
Yes.
With Mayor Norma
Rice.
Yeah. But anyways, so just engaging with different agencies and programs in the city to, you know, continue the education and to continue the to make sure that, you know, we're still doing grassroots work, you know.
Right. Oh, that's great. I am so glad. So how can someone get a hold of you?
The best way to reach us is to call our main number, which is 206-659-9998.
Will you say that again, please?
It's 206-659-9998. 206-659-9998. That's really the best way to reach us. And you know, Heart'N Soul Hospice.com. It's the word heart, the letter N, the word soul, hospice.com. That's also a great way to reach out to us and make inquiries and also find out ways to get involved with us. Which is what I'm glad Janice is able to join me, because she's really helping the community to be able to, play a role in what we're doing as volunteers. So is it okay if she does her plug?
It is. And I just want to say, that I sent you a message, through LinkedIn. I was really disappointed that I missed you last Tuesday, because I put it in my calendar as last Thursday. So I go bebopping over there, and where is he?
Okay.
Oh no, that was on Tuesday. I went, oh geez.
Oh yeah.
Oh.
But anyway, I'll catch you guys another time, I'm sure.
Just let me know. We have to.
Yeah, let me know when you're going to be doing something, because I'd love to come here and support you.
Okay, that'd be great. That'd be great. I love that.
Okay, Janice, let's hear you.
Okay, so I just want to say really quickly, we're looking for volunteers. If whether folks are experienced or not, we'll give them all the training. We will provide the training. We just want volunteers to bring the heart and the soul, because we really are Heart'N Soul Hospice, whether they are interested in providing companionship, the emotional support we just talked about. Folks really need that emotional support on that journey. Think about hospice. Think about where folks are when they are in hospice. A lot of folks just want to have somebody there with them. Sometimes it's just doing chores or running errands, reading books, listening to music.
Excuse me, Janice, when you say running errands, are you saying for the person?
For the person.
Okay.
Mm-hmm. Uh-huh. And sometimes it's supporting the caregiver.
Absolutely.
The caregiver may need just a bit of a break.
Sure.
And it's sitting and being with the patient while the caregiver runs the errands, or running the errands for the caregiver, right?
Right.
Whatever that family might need to support the patient in and of themselves. But generally, we like to connect volunteers with a family to address their immediate needs. Is it the patient? Is it the family member? Is it the immediate caregiver? We just make an assessment based on what that volunteer can give. Is it time? Is it are they talented with music? Are they skilled in crafts and they want to donate their skills around crafts? So we really just really want to invite the community, and particularly seniors that have a skill, they've got time, and they want to donate their time to aid and support others that at this critical time in their lives. So if any of your listeners are interested in serving as volunteers, I'd love for them to reach out to me directly. Actually, I don't know if I can share a flyer with you, or if it would just be helpful for me to share my contact information with you directly.
Well, do you have a flyer? Do you have a flyer? Well, I always would love the flyer and you contacting me, but do you have a flyer right now that you can show?
Yeah. Can I add it to the chat?
Yes.
Okay.
And Daniel can post it, I believe.
Yeah, let me go ahead and get
it. Janice?
Yeah.
When you were talking about crafts, what I guess, well, first off, is there a time frame for the volunteers?
Well, we like volunteers to tell us what time they have available. Sometimes it's just a few hours a month. Sometimes it's not anything too onerous. We listen to the volunteers. They tell us what time that they have available. It might be, I know I have 4 hours a month or 2 hours every other Saturday. Whatever that time is that they know that they can donate of their time, we'll work with them. To be honest, the biggest the biggest donation of time, if you will, is getting our volunteers trained and ready to volunteer. There's a pretty robust background check and training that goes into preparing our volunteers. We can't just send anybody out
Right.
to
Absolutely
be with
not.
our vulnerable patients. So we do a pretty rigorous background check, and we do lots of training. But once folks are trained and they're ready to go, we really accommodate the schedule of volunteers. So if it's 2 hours a month, if it's 5 hours a month, if it's 10 hours a month, whatever it is, we accommodate their schedule.
Okay.
And I just emailed you the flyer.
Oh, you emailed it?
Brenda.
Okay.
Yeah, I just emailed you the
Okay.
flyer. So
let me, so keep talking, and I'm going to pull up,
Okay.
if I can send it to my producer so
And
he can see it.
particularly if it's companionship, let's say there is a volunteer that loves to crochet or loves to read or
How about making jewelry?
Loves making jewelry, right? Or documenting one's life, right? Capturing the life of someone. So writing down stories of a person, whatever it might be. And they know that they're willing to go once a week or once every 2 weeks to spend an hour with that patient. That's something that is really, we see volunteers really get a lot of satisfaction from, and the patients get a lot of satisfaction from. I'm going to give you an example of how a volunteer was able to document, for example, what the patient was able to share in terms of their life story. And when they were done, they were able to leave that for the family. So when the patient passed, the family had really wonderful stories that the patient had shared with the volunteer. And it was just sort of a lasting legacy. Right. That was captured, that the volunteer played a really significant role in capturing. So sometimes it's music, listening to music together, searching for music of their time and listening to the music together. It doesn't matter. Sometimes it's just the presence of another person. When you're in the bed and you're not feeling quite well and you have the presence of another person there with you, it makes all the difference sometimes. So we're just looking for volunteers that want to serve in that way. And we'd be honored if any of your listeners would be interested in serving.
Wow, that's wonderful. I mean, yes, it is definitely a need, and I'm sure there will be someone. I'm curious, just a little bit more on the training. So is this a comprehensive training, or is it? Okay.
Yeah. Oh, so Brenda, it's probably more comprehensive than you would imagine, because hospice is a federal program, for lack of better words, Medicare. And it's audited by Medicare. We've got pretty stringent requirements. Okay. So to be honest, it's an 8-hour training program. It requires HIPAA training. It requires a pretty stringent background check, TB testing, and whatnot. We're talking about bringing people in to serve our most vulnerable patients.
Sure.
Right.
Mhm.
And so we take that very seriously. And it's our responsibility to make sure that we demonstrate a lot of due diligence around making sure folks are trained and properly screened. So yes, the training is quite comprehensive, and 8 hours of training is pretty, some might say onerous, but it's pretty comprehensive. Yes, from covering the history and the background of hospice all the way to understanding the stages of death and dying, to understanding grief, to understanding the structure of hospice, our care plans, our Y.B.G meetings, and why it's important that we understand patient care plans, the role of the volunteer, how they should be documenting what they do with volunteers. I mean, it's pretty extensive.
That's wonderful.
Yeah.
I mean,
it really is. And then for some, they go on and they want to do more work, to be quite honest. They want to go on to do what is called, I don't know if you've heard of this before, but there are those that want to do what's called end of life. Have you ever heard of a death doula?
Oh, yes. I had one time thought I was going to do that. I went through a weekend seminar. And,
okay. Well, one of the things that we'll be doing here at Heart'N Soul Hospice is our hospice training will evolve into the end of life hospice doula training. So it'll start with this 8-hour hospice training, and then it will evolve into a pretty extensive 20-hour doula training that gives folks the extended version of the doula training.
Wow. Hey, Daniel says he's got the flyer. So Daniel, go ahead and put it up, please.
Fantastic.
Can we make it a little larger?
That is fantastic.
Yeah. Okay.
Yes.
So that I tell you, just from my own personal experience and that little training that I had, it's very powerful what a death doula does.
Oh, yeah.
And it's very meaningful, not only to the patient, but to the family.
Yes.
And I decided that wasn't what I wanted to do. And then I met my mentor, Trudy, who did the facilitating training. And that's what I realize more inept at doing. I mean, I guess I'm a teacher, even though I didn't go to school, but I've done a lot of, speaking and all that. And I just felt that my role was to help people decide what they want or don't want at the end of their life. And if they can't speak it, have it already in writing. And I'm also a notary, and I can notarize it for them too.
Right.
And, because a lot of times you go to hospital and you can't speak anymore and nobody knows what you want. Or I have had a case where family wanted something different from what their sibling or friend wants. But anyway, we got to go. Daniel just told me time's up. You guys.
We could have went on and on and on.
Yeah. I'll have you back. I'll have you back.
Yeah, Brenda, you have to have Janice back. She has a lot of experience and a lot of passion for this work. She really does.
Can tell.
And so I'm glad you two connected. I want to make sure that you have her back on, as long as you're okay with it.
Oh, absolutely. And you give her my contact information.
I absolutely will. And she's on LinkedIn. I know you're on LinkedIn too. So
I don't want that LinkedIn. I want a phone call.
Okay.
Please.
Yeah. Okay. All right. I'm gonna give her your number.
Okay. Gotta go, you guys.
All right. Thank you, Brenda.
And don't forget to go. Today is the last day for the Consciousness Museum. Okay, at Rainier Avenue Radio. Bye, y'all.